Joanne, just wait. We're not there yet. I'm going to introduce you.
Oh, that's right.
Hi, everyone. Thank you so much for joining us for Advocacy and the National Registry. I'm so pleased to introduce Joanne Clynch. She is a member of the ALS Association Florida Chapter Board and is chair of our Advocacy Committee. Joanne, thank you so much for joining us today.
Thank you, Patty, and thanks everybody for joining. It's so great that you're here at Hope and Health, Hope and Help. Like Patty said, I'm part of the ALS Association Board and chair of the Advocacy Committee, Board Advocacy Committee. And I'm really involved with the chapter because of my family experiences. And through those experiences, I really want to help the community and really fight this disease. It's just a brutal disease. And in order to make it livable by 2030, we really need to do more than walks and galas and financial grants and all kinds of support groups. It just takes a whole team of advocacy to really help make this a livable disease by 2030 and really prevent future deaths and really create a world without ALS. So that's why we're here today. I just want to share with you some things that advocacy volunteers do and hopefully encourage you to become an advocate. So if you have any questions, please type it in the chat and we'll definitely want to hear from you. We have a great team of advocacy so the advocates continue to make a difference from the federal, state, and local levels. There's increased funding for ALS research. There's so many programs that have been and initiatives that have really been successful because of our advocates. And I'm going to go into the details a little further. The ones I've mentioned on this screen are just the tip of the iceberg. So you might ask, how can I participate? So it really starts with you. You sign up. It's very easy. In fact, we'll send you an email after this session and you get an action alert. And that action alert is prepared and delivered to your email, and it has all the essential information that arms you with the facts that you can communicate with your legislators. And as you may or may not know, advocacy is all about building relationships. So once you take those action alerts, use the information to communicate to legislators in your district, it really helps to foster and build and grow those relationships. And that's what our team does day in, day out, week in, week out, and month out. And then annually, we have a federal advocacy day that we participate in that the ALS Association hosts. The past couple of years, it's been virtual. And, normally it's in person, but we've still had the advocacy day and had much success with it. I included a picture here of our advocacy team when we were able to meet in person last. But this year we had some real success. We had 30 people from Florida sign up, and they attended these educational events and summary speakers, and then also attended 8 different special sessions with some key members of Congress that are part of Appropriations Committee. So that really helped tremendously with our advocacy. So some of the wins we've had that I touched on the first, when I first started, are really important for ALS patients and families. The advocates directly help the Social Security Disability Insurance waiving that 5-month waiting period. So again, building relationships and helping to communicate why it's essential that this had to be waived really helped inform and educate our legislators so they understood the need. Also, the advocates helped with the 2-year waiting period and waived that for Medicare benefits. Another win for patients and families. in Florida. Also, some very significant federal funding increases happened from 20 to 40 million for the DoD for the ALS Research program, which is really essential to find treatments and cures. We also went from 83 million to more than 100 million over the past couple of years at the NIH. So that's important funding, again, to find treatments and cures. And we'll be hearing from Song in a few minutes about the CDC National ALS Registry and Biorepository. That's a really important initiative and program that advocates helped and still help today make sure that that continues. So we've also worked as an advocacy team to implement historic regulations at the Department of Veterans Affairs, making sure that ALS is a service-connected disease. And that truly helps with our veterans, who are more than twice as likely than civilians to, or people who haven't served, to get ALS. On the state, we also worked to build relationships and had some real wins this year. The Bittner Plant ALS initiative is a very important initiative that advocates work to make sure that we have the funding. And this year, we in the next fiscal year, Governor DeSantis signed it, and we have $1 million in appropriation, which will help support the 5 certified centers of excellence in the state. And it's really the highest amount the program has received since the 2015. We've also established what we call the first ever district leads across the state. So across our 29 districts in Florida, we have leads that are spearheading the communications and relationship building in support of all the advocates in Florida. And so we leverage their personal experiences on the advocacy front to help encourage new people and make sure that new people feel comfortable and successful when they join our advocacy team. So I really wanted to leave you with this. You really can make a difference. Your voice and experiences help educate others. Advocates are constituents and have an important role in the process. Legislators really want to be informed, and we've had very positive interactions across both sides of the aisle at the federal level and the state level. And we find as a team that, you know, they just want to hear from us and they want to understand the needs. And we all know what it's like, and so we're the perfect group to educate those who don't know about ALS and its impacts. So with that, we're going to talk about the CDC Biorepository, and I just really wanted to take a pause here and say that we are so pleased to welcome Song Zhu. Song is presenting on behalf of Paul Menta on the National ALS Registry, and he has a wealth of information, and we thank him for stepping in. So with that, I'll turn it over to Song.
Hi all. Let me try, give me a second as I get my screen share up. And I will be able to start my presentation on the ALS Registry. Screen share doesn't seem to be working. Give me a second. Oh, there we go. Thank you to the ALS Florida chapter for inviting us. As Joanne mentioned, my name is Song Zhu, and I'm actually here on behalf of our National ALS Registry team and our PI, Dr. Paul Menta. Unfortunately, he had a previous conflict, so he wasn't able to come give you this this talk himself. So please forgive me if I, am not as succinct in delivering this information as he would have been. But I just wanted to give you guys a quick outline on what the National ALS Registry and the ALS Registry repository does, and how you can help and join in advocacy on a federal level. First, just a quick disclosure that none of these things that I'm presenting are necessarily represent the official position of the CDC and the ATSDR, but we'll go ahead. Just a quick outline. I just wanted to give everybody a rundown of the goals of the National ALS Registry, how research counts on the participation of PALs and persons with ALS and their caregivers, all how the data helps further ALS research, and finally end with any questions or comments you might have about the ALS Registry. So the goals of the National ALS Registry are mainly to use people's data to find out what causes ALS, learn about the different risk factors, to report on the number of ALS cases in the US, basically trying to find the who, the what, the why, and the when for what causes this disease. How the ALS Registry goes about using this data. First, we collect and analyze ALS data, and the ALS Registry is a participation registry. So because ALS is not a nationally notifiable disease, we rely on patients to join the registry, to take part, supply their data, and we use this data to observe, changes in disease patterns over time, to help identify common risk factors, and we use the registry as a resource for researchers in clinical trials to access thousands of patients and help further along the research. And in the how, there are multiple ways and multiple mechanisms that we use to help further that research. So ALS research counts on people living with ALS to contribute their stories to the research studies and our risk factor surveys. Without you, there's no progress. You have the data that no one else can give. We're looking for things like, particulate exposures, chemical, metals, environment, or any other occupational exposures. And it's really important that ALS patients themselves are able to provide, a full recount of their experiences and the things that have affected them. Again, answers cannot be found without your support. There are currently more unknowns than knowns about ALS, so counting every case and making sure everybody who has ALS in the country is vital to helping us advance our research. Your ALS data helps complete this puzzle of ALS research. Just comparing, a few data points to thousands of data points really helps to forward the research and the knowledge that is gained through this research. For example, the ALS National Registry has in the past supported, at this point, over 60 different clinical trials. Here on the screen are just the 5 most recent trials that we've supported by sending notifications out to people registered in the registry so they can join these clinical trials and research studies. You might not know of these right now, but one of the more famous ones was we helped support the AMX 35 trial by providing ALS patients to that clinical trial. We've also funded over 20 trials and research studies from various institutions, commercial and academic, since the inception of the ALS Registry in 2010. So this just shows, how important research is and how we like to advocate and provide a resource to connect researchers and patients to further along research studies. Finding research studies that apply to you can be an uphill battle, and patient recruitment can be challenging. So after patients join the ALS registry, they can participate in joining the research notification. So whenever we do find a new study that we're going to partner with or we fund, then we automatically send out notifications to anybody who's on the registry, and also public notifications through social media to make people with ALS aware that these studies are available and that they can sign up for these studies. We also include 18 risk factor surveys that survey people's backgrounds and demographics, varying from just their basic demographic information to occupational health hazards, to occupational history, to environmental history, to any sort of exposure history that they might be able to recount to further broaden the scope of the data that we collect. And then finally, the registry also in 2017 created the National ALS Biorepository, where patients with ALS can actually opt to send blood samples, saliva, either through home visits or visits with their doctor to help further the research as well. It provides a resource for academic researchers or other clinical researchers access to this biosample data. Just wanted to wrap up and thank the ALS Association of Florida for hosting us. It's very important, and that we partner with our local partners to get boots on the ground. And the National ALS Registry find it vital to maintain these partnerships in order to expand our outreach and increase our advocacy in order to further along the research and be able to find potential causes and hopefully work towards finding a cure for ALS. If you have any questions about the registry, I have a few minutes left to answer, but also if you want to find out more about the registry and the biorepository, or if you want to join the registry, please visit cdc.gov/ALS, or you can email the ALS registry at als.cdc.gov, and also feel free to call. But at this point, I will end this and open it to any questions that people might have.
Thank you, Song. I'm looking at the chat feature and keep an eye out if any questions. And one of the things I would like to ask, sometimes the staff of the chapter, we ask patients if they've enrolled with the registry, and sometimes they're not sure. They have so many websites that they sign up with. They have so many different sources of information and support. If they're not sure if they've signed up, what's the best way just to check and see if they've got an account and if they've started that process?
The best way to check would be honestly to send an email to als@cdc.gov and we can check for you. We do send out newsletters quarterly, so if they're receiving newsletters, they should be able to they would know that they're registered. And also, once you're registered, you can access the ALS Registry's portal, and if you log in and take risk factor surveys or sign up for clinical trials. So just if those steps don't work, then the best way is just to reach out to us either through email or through the phone, and we can double check for you.
Okay, thank you so much for that. And we have just 45 seconds left in our session. Joanne, I just wanted to ask you, when someone signs up to be an advocate, what can they expect? Like, what do those action alerts look like? Are they annoying? Are they easy to follow?
They are so easy to follow, Patty. That was the first entry that I had into advocacy. And literally, you get an email with all the documentation prepared. And when you want to interact or communicate with your legislator, you literally click a button. It even has an option where it helps you automatically find that legislator, where you can send the prepared remarks that you can even edit to tailor to your interest and need.
Good. That's great. Okay, well, thank you so much, everyone. Great session. Look forward to seeing you next time.
Thank you, everyone.
Thank you.
Thank you, everyone.